Prime Minister Narendra Modi speaks to Assam Chief Minister Sarbanand Sonowal over flood situation, COVID-19 and the Bagjan oil well fire scenario. Prime Minister assures all support to the state. Delhi receives heavy rainfall. IMD predicts thunderstorm with rain in the national capital and neighbouring areas till July 21st. Flood situation remains grim as all the major rivers in Bihar flow above the danger mark. Three-member Central Health Team reaches Bihar to review the status of corona epidemic in the state. India's focus on early case detection and saving lives to COVID-19 through tracking and testing. 11 most COVID-affected countries together reported 8 times more cases and deaths than India. Over 6,77,000 COVID-19 patients in India recover. Active cases stand at 3,73,000. Arunachal Pradesh government extends lockdown in capital Itanagar region till 3rd August. Courts rapidly adopt digital technology amidst COVID-19 pandemic. Union Law and Communication and IT Minister Ravi Shankar Prasad says High Courts heard 1,75,000 cases and subordinate courts 7,34,000 cases virtually. Supreme Court also completes 7,800 cases. Coronavirus cases across the world continue to spiral up with over 1 crore 42 lakh confirmed cases. Global recoveries rise to over 79 lakh 83,000 with over 6 lakh fatalities. Worst affected United States reports over 70,000 cases in the last 24 hours. 41 out of the 50 American states see surge in cases. And Arsenal blank Manchester City 2-0 to reach the FA Cup final. Will meet the winner of the second semi-final between Chelsea and Manchester United to be played later tonight. Good afternoon. Welcome to English News. I am Anil Thomas. Now for the stories in detail. Prime Minister Narendra Modi today talked to Chief Minister of Assam Sarbanand Sonowal. In a tweet, Chief Minister Sonowal informed that the Honorable Prime Minister Shri Narendra Modi ji took stock of the contemporary situation regarding Assam floods 2020, COVID-19 and the Bagjan oil well fire scenario over phone this morning. Expressing his concern and solidarity with the people, the Prime Minister assured all support to the state. In Assam, with little respite from the downpour in the past 2 to 3 days, slight improvement could be witnessed in the overall flood situation. However, over 27.5 lakh people still remain affected by the flood waters in 2,678 villages across 26 districts of the state. For more on this, we are joined by our correspondent Kamal Bora joining us. Kamal, what's been the situation there in the state of Assam in the last 24 hours? Has there been rainfall that's receded there, and how's the situation there on ground zero?
Yes, Anil, see, already I have spoken in the morning also that yes, situation is still grim.
Okay.
But however, we have seen little respite from downpour in the last 2 to 3 days, and water level in most of the river started receding, and that is why the number of affected people has come down. But still, there are more than 27 lakh people are there as affected as on date. But from today morning itself, we have observed that gloomy sky all over the state, and as Met Department has already predicted that the heavy rainfall may occur. So today may be a start of that scenario may turn into a worse in next 2 to 3 days if heavy rainfall take place. So everything is dependent on rainfall right now. as you have already mentioned, that Prime Minister has also expressed his concern towards the people of Assam, flood-affected people, COVID-19 affected people. So it's definitely going to boost up the morale of the people of Assam at this moment. But as far as the flood situation is concerned, yes, we have to say that situation is still green.
Okay, also when it comes to the IMD showing a red alert, especially when it comes to the northeastern state of Assam, Meghalaya, all connected to each other there, the northeast of India, there's been a red alert issued. How much of, a situation there on ground zero when it comes to handling the COVID situation along with this, rain fury that's hit the state, how much of it is a challenge, and how prepared is the state government to handle the situation?
Yes, Anil, let me tell you that every year flood comes, and that is why Assam used to be prepared to handle the flood situation. Because Assam government used to keep all these relief materials in preserve, and NDRF and SDRF, they used to be ready at all the time. But at this moment, since COVID-19 scenario is also worsening across the state, almost every day more than 1,000 cases are being detected. So Assam government has to deal with that issue also. And at the same time, if we talk about the relief camps, see now since quarantine centers, a number of quarantine centers has also to be increased. At the same time, relief camps are also to be set up. So it was a real challenges for the district administration to identify places for relief camps. At the same time, quarantine centers also. And at the same time, if we talk about the rescue operations, special measures have to be taken by the rescuers while going for rescuing people, because they have to maintain the social distancing also, and they have to save themselves also from getting infected. So it is a real challenges for the rescuers, at the same time for the state government also. So however, whatever may be the situation, Assam government is fighting with both the situation with full spirit.
Okay, we'll leave it there. You take good care of yourself. We'll come back to you for more update. Meanwhile, that video of that exhausted rhino there resting on Assam highway that went viral, many people, netizens, praising the authorities for guarding that rhino there on the national highway. Well, moving to Bihar, where the flood situation remains critical as all the major rivers in the state are still in spate. Budhi Gandak river has inundated a village in Muzaffarpur. A population of over 2,92,000 in 8 districts of the state is flood affected. Over 11,000 people have been evacuated from the areas that have been affected. 7 relief camps have been established in which more than 2,000 people are sheltered. 27 relief camps are being run to provide cooked food to around 20,000 flood affected people. Many of them are sheltered on embankments. According to the IMD, Bihar will witness heavy rains till July 21st. Back in the national capital, Sunday we woke up to heavy downpour this morning as heavy rains lashed the national capital, Noida, Gurugram and other NCR regions. Rains that started in the wee hours today turned into intense spells, leading to waterlogging and traffic jams in several areas. Areas like Minto Bridge, ITO, Wazirpur, Mulchand and Hanuman Road witnessed waterlogging. Meanwhile, Met Department has predicted thunderstorm with more rain in the national capital and adjoining areas till Tuesday. Despite the early arrival of monsoon in Delhi, the rains have remained subdued. According to the IMD, the Safdarjung Observatory has recorded 47.9 millimeters of rainfall in July so far, which is 56% less than the normal of 109.4 millimeters. The Met Department has also predicted continuous rainfall for the next 3 to 4 days in adjoining states of Punjab and Haryana as the monsoon trough will move north. Uttar Pradesh will also witness heavy rainfall till July 21st. While in south, strong winds are very likely to hit Karnataka, Kerala, coast and Lakshadweep area. Fishermen are advised not to venture into sea over these areas. In Uttarakhand, overnight heavy rainfall was witnessed in many areas, leading to overflowing of the Gori river. Some houses were damaged and livestock washed away in Choribagar. Local administration said that efforts are being made to restore the movement on roads which are damaged. The Met Department has issued an orange category warning for Uttarakhand on July 19th to 21st. An orange category warning indicates that disaster management and local authorities should prepare for disaster control. With Bihar seeing a spike in the number of COVID-19 cases, a 3-member team of experts from Delhi reached Bihar today to take stock of the situation there on ground zero in the state. The Union Health Ministry's multidisciplinary team, headed by its Joint Secretary Love Agarwal, is reviewing and coordinating with State Health Department in managing the COVID-19 outbreak in the state. The team will provide necessary support and guidance after reviewing the situation. Director of the National Centre for Disease Control, Dr. S.K. Singh, and AIIMS New Delhi Medicine Department Associate Professor Dr. Neeraj Nischal are the other 2 members of the central team. The recent spurt also necessitated reimposition of a complete lockdown in Bihar till July 31st. Well, for more inputs on that story, Salman Haider, correspondent, joining us on the phone line. Salman, the central team is there in the state of Bihar. What are they expected to do, and how easily, because you mentioned about 3 districts, 3 places that have been affected. How are they going to visit all these 3 districts in the first day itself, and how are they going to coordinate with the state health authorities?
Detail of the program, their detailed program has not come yet,
okay.
But they are in meeting with the senior health officials of the state, and they are reviewing the situation about these 3 districts, Gaya, Bhagalpur and Patna, where there is a spike of cases during past one week. So they will review the situation and advise the state machinery, health machinery to improve the situation. Meanwhile, this number of testing has increased. That is why more cases are coming into light. But overall, the situation is, of course, under control, and testing facilities have increased. As many as 24 testing centers have been opened in Patna itself, and other districts also. They are going to up to PHC level, and facilities would be available at PHC level, so that everyone or anyone who wants to check himself or herself can get tested for COVID there. So the team will review all the situation, that protocol, whether protocol is being followed or not, and all that. So they will review, and after that more details will come.
Okay. Purely looking at numbers from Bihar, July 1st, Bihar had roughly 10,000 cases. And now when you look at Bihar, the latest numbers by the Ministry of Health and Family Welfare, the numbers have swelled to 25,000. What's been the case? Is it more testing that's been done that's led to this surge in the number of positive cases that have been found?
Mainly testing. Due to testing, the number have spiked.
Okay.
Testing has just doubled from the previous 3,000 to 5,000 to now 10,000, 11,000 testing are being done. And the state government is planning it to take up to 20,000 per day. So 3 lakhs, over 3 lakhs tests have been done so far. So the testing is increased, so the number of cases are increased.
Okay.
That is the situation here. Yeah.
Okay, we'll leave it there. Thank you and appreciate you joining us this afternoon with those updates there, as a central team from Delhi is there in the state of Bihar to review the existing situation there and also to provide inputs and necessary support and guidance to the state. Moving on, while it is true that COVID-19 cases are rising in India, the focus is on early case detection and saving lives. The 11 most COVID-19 affected countries in the world, including United States, Brazil, Russia, Peru, Chile, Mexico, South Africa, United Kingdom, Iran, Pakistan, Spain, together reported 8 times more cases and 14 times more deaths than India. The focus of containment strategy remains on house-to-house survey, perimeter control activities, timely contact tracing, surveillance of containment and buffer zones, aided by effective clinical management of severe cases through a standard of care approach. Continuously expanding hospital infrastructure has aided in increased recoveries. The latest testing strategy of ICMR allows all registered medical practitioners to recommend testing. According to the Indian Council of Medical Research, 1,37,91,869 samples were tested for COVID-19 so far in the country, out of which 3,58,127 were tested on Saturday. Meanwhile, the actual load of cases or active cases in India currently stand at 3,73,379. Most of the infected patients have recovered and have been cured. The recovery rate has been improving at a good pace. It currently stands at 62.86%. Medical attention is also being provided for all active cases, either in home isolation or in hospitals for severe cases. The number of recovered cases has further increased to 6,77,422 patients. The difference between recovered and active cases is progressively growing. It stands at 3,04,043 today. 26,816 patients have died due to COVID so far. The battle against COVID-19 pandemic has reached a crucial stage in India as the human trials of Indian vaccine is underway. The All India Institute of Medical Science will conduct human clinical trials of the indigenously developed COVID-19 vaccine candidate Covaxin from Monday. 100 volunteers between the age 18 to 55 years will be part of the crucial trials. Healthy participants with no comorbidities or without a history of COVID-19 will be selected. People only from Delhi and the National Capital Region will be able to take up the trial. Corona as well as liver test will be undertaken before the trial. Two doses of vaccine will be given to the volunteers. There will be a gap of 2 weeks between both the doses. The vaccines will be administered through injection. The emphasis, however, remains on safety and screening, with ICMR scientists keeping a constant vigil on the matter. People can register to become volunteers by dialing the number 074 288 47499 or mail at ctaims.covid19@gmail.com. Two vaccines developed in India were given approval for human trials by the DGCI. Union Health and Family Welfare Minister Dr. Harsh Vardhan has said that with this, the fight against COVID has entered a decisive phase. Union Health Minister Dr. Harsh Vardhan launched the plasma donation drive in AIIMS with the help of Delhi Police. The Delhi Police has started the campaign by donating plasma. Female officers and other senior officers of the Delhi Police participated in a plasma donation drive. A plasma bank has been set up at AIIMS to provide plasma to coronavirus patients. It has emerged as an effective solution in treating the novel COVID-19 situation. Seriously ill people have benefited from plasma. ICMR is also still researching on it. Appreciating the plasma donors, the Health Minister has appealed to the people that those who have recovered from corona should donate as much plasma as possible. Moving to Arunachal Pradesh, where the state government has extended lockdown in Itanagar, that is the capital region, till August 3rd to break the chain of local transmission of COVID-19. Initially, a week-long lockdown in the capital region Itanagar was imposed on the 6th of July to the 13th. But in view of the increased number of COVID-19 positive cases, the lockdown was extended till 20th of July morning. Chief Secretary Naresh Kumar today announced the further extension of lockdown till 3rd of August. The state has also issued new SOPs, and as per the new guidelines, all people including paramilitary forces and truck drivers engaged with essential supply who are entering in the state will go through rapid antigen test. All officers except identified essential works and commercial establishments will remain closed. Shops on colonies or small street areas will be opened on designated date and time. Meanwhile, 99 persons recovered during the last 24 hours in the state of Arunachal Pradesh, while 41 new positive cases were detected from the state. A total of 373 active cases in the state as of now, and over 38,000 samples collected for COVID-19 tests in the state. After 3 weeks of strict lockdown that was put in place due to the sudden spurt in the COVID-19 infection, Guwahati city is all set for an unlock phase from tomorrow. Assam Chief Secretary issued new guidelines for relaxations during the next 3 weeks. The relaxations will begin from 7 p.m. today and shall remain in force until 7 p.m. on the 2nd of August in the entire Kamrup Metropolitan District, where Guwahati is located. Private vehicles, both four-wheelers and two-wheelers, are strictly barred from coming on to the streets except for medical emergency and official duty, while lockdown norms in certain areas will continue till further notice. The state government has also restricted all inter-district movement of individuals from the 22nd of July onwards until further orders, except for medical and last right emergencies. In Goa, the streets wore a deserted look on day 3 of the 3-day lockdown in the state. Only essential services like medical stores, milk shops are allowed to function. All non-essential movement is banned except cabs. State has gone into complete lockdown from July 17th in view of the rising number of COVID-19 cases. State will be observing Janta curfew till August 10th. The state administration has also imposed a ban on a movement of all individuals for all non-essential activities between 8 p.m. to 6 a.m. till August 10th. Union Law and Communications and IT Minister Ravi Shankar Prasad has said that Digital India Today has become a transformative program whereby common Indians are getting empowered through technology. Delivering the keynote address at the late Thakur Prasad Centenary Memorial Lecture via video link, the minister said that the digital infrastructure in the country has helped provide a variety of e-governance and direct transfer services through the COVID-19 pandemic.
Is COVID mein high courts have conducted 1,75,000 cases virtually. 1,75,000. Subordinate courts have conducted 7,34,600 cases. And Supreme Court has done 7,800 cases. तो अगर डिस्ट्रिक्ट कोर्ट भी 7,34,600 केसेस वर्चुअल किए, ये तो बड़ी बात है. The digital power, the virtual power we are having.
Prime Minister Narendra Modi condoled the death of US Congressman and civil rights champion John Lewis. In a tweet, he said his legacy will continue to endure and inspire. Well, that's all we have time for in this edition of English News. But remember, we need to follow social distancing, but we need to keep our emotional bonds stronger in this COVID times. That's all we have time. Thanks for watching.